Dr. Devesh to give his talk.
Good evening, everyone. So I'll be sharing some tips and tricks about when to start and how to excel in FRCOphth London examination. So this is the website from where I have prepared most of my presentation. So you can visit this website for all the information. So FRCOphth examinations, it stands for the Fellow of the Royal College of Ophthalmologists London, which is a prestigious award of fellowship provided by the Royal College, and it constitutes of 4 examinations, and if you clear that, then you need to pay a membership fee, and then you become a member of the Royal College, and then you can use the post-nominal FRCOphth. And it is the exit exam for the ophthalmology trainees in UK. So it is considered as a very important examination of international stature. Now, the 4 parts, the part 1 is the written basic and the clinical sciences exam. And there is no minimum ophthalmic training required for this, for taking this exam. Even in your first year of ophthalmology training, you can undertake this exam. Now, earlier the route was to take the refraction certificate exam and then the part 2 written exam and then part 2 oral exam. That would be the 4th exam. But recently, for the last couple of years, there is a change that you can undertake the part 2 written exam before refraction certificate exam, and then you need to complete both the refraction and part 2 written exam before appearing for the final oral examination. Now, it is also for the refraction certificate, there is no minimum training that is required, but for the part 2 written exam, you need to have at least 4 years of ophthalmology training. Mind you, there are no exemptions in FRCOphth. There are exemptions in FRCS, but in FRCOphth, there are no exemptions. You need to appear for all the 4 examinations. Now, when do you need to start and how do you excel? You have to decide early. Like for all other examinations, you have to decide early. Residency is the best time because you have a balance of both the academics as well as the clinical work, and you'll be fresh with the knowledge. So just after the residency would be a great time, or during the residency, final year of residency will be a great time. Now you need to know, read and plan your studies accordingly as per the syllabus. And you, in addition to that, you need to have good clinical experience and skills because that will help you in the clinical examination session. Now, part 1 fellowship examination is an online proctored exam. So part 1 fellowship exam and the part 2 written exam are both online proctored written examinations of 2 separate examinations of 2 hours each with 90 questions in each session. And the paper is a theoretical paper which is based on the basic and clinical sciences which are relevant to ophthalmology and patient investigations. So although there is no minimum training that is required, but for the basic and the clinical sciences and patient investigation, I think the ideal time would be the 3rd year of residency because then only you'll know about these aspects. Now this is the syllabus that is given on the website also. And the important resource will be a basic and clinical sciences course by American Academy. In addition to that, you can read clinical optics by Elkington as well. Refraction certificate, it's a practical exam and it consists of 10 stations, OSCE stations, which constitute of 2 stations on simulated retinoscopy. There will be a simulator eye and you have to perform a retinoscopy on that. Then you have 2 stations on non-cycloplegic retinoscopy on patients. Then you have stations on subjective refraction, refinement of sphere, refinement of cylinder, and then you have, in addition to that, you have lens neutralization or use of photometer as well. Now, when to appear, again, there is no minimum requirement which is there, but you are unlikely to pass this exam without having extensive practice and experience in refraction. So for instance, I had to practice for nearly 2 to 3 months. Daily, I used to practice on 5 to 7 patients and do it religiously, do all the steps of refraction, starting from your objective to subjective and then binocular balancing in the end. So that is when you are able to do it accurately and within the time. Now, resources, the last resource which is mentioned is an excellent and very concise resource that you can read, and it tells you how methodologically you have to follow the refraction procedure, and you should not skip any procedure that is mentioned in that book. Now, most important again is the practice, irrespective of whether you read, unless you do it, you practice it, you're not going to clear this exam because you are not only going to be marked based on the accuracy of the refractive error that you diagnose at the end of examination, but you will also be marked on the high-end hygiene, rapport, communication, and time management in this station. For instance, in my feedback report, it was mentioned that while using one of the lenses, I did not clean the lens back and I touched the central part of the lens. So that also goes against your marks. Now, part 2 fellowship written exam, it's again an online proctored exam with 2 sessions of 2 hours each, 90 questions in each paper. Again, it's a theoretical paper, but it covers the entire curriculum. The OST is the ophthalmic specialist training curriculum, that is for the UK postgraduates in training. So it's the theoretical paper that covers the entire curriculum. It is same as the syllabus of MD and DNB or MS in DNB. When to appear, you should have cleared the part 1 examination and you should have minimum 4 years of training. An ideal time would be a fellowship or senior residency. Now, what is different in the syllabus over here is health promotion and disease prevention and continued professional and personal development. These 2 domains are something which the college pays very importance to these domains, and there is equal mark distribution and for these domains as well. So it's not only the basic and the clinical sciences and patient management that you need to be aware of, you need to be aware of these other domains as well. Now, part 2 fellowship oral examination has 2 formats, as in the FRCS examination, that you have the structured viva and the OSCE. Again, the entire curriculum will be, you're asked to know you should know the entire curriculum. And again, you have to have minimum 4 years of ophthalmology training and should have cleared the part 1 refraction and part 2 written examination before appearing for this exam. Now, structured viva, the difference between FRCOphth and FRCS is that the first 3 stations remain more or less same, but you have attitude, ethics, and communication station as well, and you have an evidence-based practice, health promotion, and disease prevention structured viva station as well. Now, in the OSCE, you have multi-station video as well as clinical examinations. You have videos which are shown to you, which will be very focused on a particular finding or a particular disease, and you have to answer the questions that you will be asked. And then you have one patient in each station, and you will be asked to do a focused examination on those also. So you have different stations, and then in the last, you have a communication skills also station, in which you have to counsel a patient who might have undergone surgery and there was some complication, or you have to break bad news to the patient. So that communication skill session is very important, and often if you don't pay attention to that, then you might not pass that communication skill station. But it doesn't matter. Overall, you should not have red flags in most of the stations. If you have red flag in one station, then that can be covered by marks in the other station as well. Now, certain tips: you should prepare the content list and plan the time distribution in advance, like in any other examination. The go-to clinical books will be again Kansky and Oxford, or any other book that you would have studied for your MD or MS examination or DNB examination. For the topics that are different from our MD/MS syllabus, you can consult the Oxford Manual of Training in Ophthalmology for the topics on attitude, ethics, and communication, and health promotion and disease prevention. Now, RCOphth guidelines and current GMC guidelines are very important. They directly ask questions, not only in the theory exam, but also in the practical and viva. They ask directly questions from the guidelines. Ophthalmic investigations are paid very great weightage. There are very limited MCQ books or preparation resource material for FRCOphth examination. One of the MCQ books is by Darren Ting and David Steele. And then you have a Viva and OSCE book by Timothy Fung and Winfred. And these books are really helpful. Now, if you see the pass criteria, these examinations can have pass rate as low as 30% to as high as 70%. And it somehow depends on the place also where you are undertaking the examination. So if we see in the Indian setting, the examination, always the pass results have been on the lower side. And in Delhi, May 2020, the pass result for the refraction examination was as low as 39%. Validity, you have 7, you can take maximum 7 valid attempts could be taken, 6 attempts could be taken. It's a long roadway, multiple steps are there is prolonged interval between the exams, you cannot appear after giving the first examination for the next examination immediately. Limited centers which are there, but in India, yes, there are centers coming up in India, in Mumbai, Chennai, and now in Delhi also we have centers. And then there are limited dates, that is the seats. And this is the examination calendar. You can visit the website for that. The prices for these examinations are exuberant. And if you see the 2024 fee, in INR, it would be something around 2,56,000 for the last step itself. And for the second refraction step, it is somewhere around 1,15,000. So these are very pricey, very expensive examination, and you should think before starting to appear for these exams. Now there is an annual subscription fee also. If you want to retain the post nominal, you need to pay this annual subscription fee every year to retain that nominal. Otherwise, the college sends you a mail that you can't anymore use the nominal now. Now, given said that if you clear this examination, you have a prestigious award that you get, and you have a very grand admission ceremony that happens in United Kingdom in London. So that is something that is very rewarding. And there are other benefits of doing FRCOphth as well, as Dr. Akshay has already told, that you get an exemption from PLAB, and then you can directly apply for CSER for registration as a specialist. There are certain exclusive benefits that are there to those who become a member, that you can have access to the iJournal, and then One Network, reduced fee for the annual congress that the Royal College conducts. And you can have an opportunity to become an examiner also in these examinations. So once you become a fellow, after a certain duration of clinical experience, you can apply for being an examiner in these fellowship exams also. So the mantra for all these examinations remain the same. You should know the syllabus, you should plan it well in advance, and then there is no ideal time to appear, as successful people never stop learning. So if you want to do it, you can do it now also, but the preferable time will be in residency, end of residency, or just the starting of senior residency or fellowship. Thank you.
Thank you, Dr. Devesh. Very comprehensive.